I am Dr. Andrea Cohee, an assistant professor in the IU School of Nursing and member of the IU Simon Comprehensive Cancer Center. Like our fantastic speaker today, my research focuses on fear of cancer recurrence. Specifically, I'm interested in how partners and spouses of breast cancer survivors deal with their own fear of recurrence. I'm currently designing a trial to help partners manage their fear and leading a second study to better understand what contributes to their fear of recurrence. At the end of Dr. Johns's presentation, I can share my contact information if any partners or spouses might be interested in this work. I'm thrilled to introduce our speaker today, Dr. Shelley Johns. She would grow tired of hearing just how admiring and formal of an introduction I could give, so I'll try to be brief. But I do need to tell you a little bit about how incredible she is. Dr. Shelley Johns is a board certified clinical health psychologist, associate professor of medicine in the IU School of Medicine, and member of the IU Simon Comprehensive Cancer Center. She has worked in cancer care since 1996 as a clinician and a scientist, caring for the psychological needs of adults with cancer. Dr. Johns has led several clinical trials over the last decade designed to reduce cancer-related suffering, including fatigue, distress, and fear of recurrence. The goal of her upcoming study and our topic for today is to help survivors manage their fear of recurrence. I've been honored to work with Dr. Johns and call her a friend since we met 11 years ago. We hit it off right away when I was beginning my PhD program and she was beginning her research fellowship in cancer prevention and control. She's an immensely warm and loving, caring person on top of being incredibly smart and hardworking. Dr. Johns, I'm excited to hear your presentation and we'll turn it over to you. After you finished, we'll open it up for questions from our audience.
That sounds good. Thank you so much, Andrea. And I also want to give a plug in for Andrea as well. She is a colleague that I have loved, adored, and respected, who has taught me a lot, through the years. I think we've learned a lot together. And I really appreciate her willingness to be here with us today. I also wanted to share, Andrea had mentioned that I've been working in cancer care for 25 years this year. So this is my quarter century year with that. The reason why I'm interested in this topic, fear of recurrence, is because the very first patient that I saw on my first day of work back in 1996, she was a young breast cancer survivor. She had a small child at home and she was really struggling with fear of recurrence. And there were no evidence-based treatments for fear of recurrence at that time. And she really touched my heart, and I just adored her so much, and I wanted to be able to to be of support to her. But when I turned to the literature to figure out what can I offer her, there was nothing. And so I had to kind of cobble some things together. And I've been working on this issue, ever since, because almost everybody that I'm honored to work with in clinic has, fear of recurrence, as you would imagine, because it's a completely understandable human and natural concern. So anyway, I just wanted to give you that little context. And also I wanted to mention one other thing. I always like to announce my biases whenever I give talks, just so you know a little bit about where I'm coming from. So obviously I'm a middle-aged white woman. So my perspective, comes from, being middle-aged and white. And then I also, although I've never had cancer myself, I have several family members with cancer. So I know kind of from the co-survivor, end of things. But I have lived with type 1 diabetes for almost 50 years. And that is also a disease totally different from cancer, of course, but it's a disease where I have grown up with fear, living with fear of complications, of my diabetes, fear of blindness, fear of, having a stroke or a heart attack or losing a limb, being on dialysis, losing a kidney. So those are some of the things that have kind of informed the work that I've done through the years, because I never wanted my fear of complications of my disease to stop me from doing the good work that was meaningful to me, or from, being involved with my family and things like that. So I just wanted to announce those biases because it will kind of color some of the things that I'm going to say. So I'm going to take just a moment here and draw up my slides. So give me just a quick moment. And I did also want to announce to all of you, I think at the bottom of your screen, there's kind of a crawl that goes across that announces how you can put in questions if you have any any questions that you haven't already submitted. We've gotten about a dozen questions in, or maybe even more than that. But if you have any other questions, just be sure to put those in at any point. So I also wanted to mention that the first part of this title, the waiting for the other shoe to drop, those were not my words exactly, but I got those from a paper that was published from a qualitative research study where cancer survivors were interviewed to talk about their fear of recurrence. And so that was one of the quotes from that paper in terms of what it meant to this particular survivor who was interviewed to share her perspective on what fear of recurrence felt like for her. And it was waiting for the other shoe to drop. Some of the other quotes in that paper, there was one that really stood out to me about feeling, like a prisoner, kind of trapped in a cell, because of the fear of recurrence, just feeling, like you're trapped with it. And so those are the kinds of quotes that really make my heart, really make my heart beat, because it just shows me how much suffering there is related to this understandable fear. So we'll just take just a quick minute to announce that, as you probably know, there are about 17 million cancer survivors alive in the US today. And this is great news because it means, treatments are more effective. It means that we're detecting cancer earlier when it's in its more treatable stages. In fact, you can see, on the slide there that most cancer survivors alive today were diagnosed more than 5 years ago. And then even, about almost 20% were diagnosed more than 20 years ago. So people live, or can, not all the time, but people are able to live years with cancer sometimes. And then that means that, there's oftentimes living with the unsettling nature of the uncertainty of not knowing when that other shoe, could potentially drop. So I also wanted to mention that, Andrea and I will use terms like cancer survivor throughout the talk today. And I know that that is a term that some people, it really resonates with some people, and other people cannot stand that term. So if you are one of those people where you don't like that term, I please do accept our apology. We just kind of do that to kind of shortcut and save time as we're talking today. So also, this slide will be a little bit more important because I need to justify something a little bit later. But you can see that in terms of the number of cancer survivors, we have more prostate and breast cancer survivors than any other type of cancer. Those are, usually pretty treatable cancers, and so people can live a long time with those two cancers. But we also have a lot of, colon and rectum cancer survivors. We have a lot of uterine cancer survivors, a lot of melanoma cancer survivors as well. So I just kind of like to throw that slide up because it just, it's pretty inspiring, I think, to see all of these numbers as we go along. So since we're here to talk today about fear of cancer recurrence, I wanted to share with you the kind of the official, agreed upon definition of what this is. And you can see for yourself there, it's the fear, worry, or concern related to the possibility that cancer could come back or progress. And it's, as I have mentioned a couple of times, it's a completely understandable human emotion, because whenever we feel vulnerable, and anytime that you hear your name and cancer in the same sentence, there's going to be a certain amount of vulnerability there, understandably. And so we just it is understandable, because there is no oncologist that I work with that ever gives any of their patients an absolute ironclad guarantee that the cancer will never come back. Most oncologists, are pretty upbeat and, try to be as honest, as possible, but there's no guarantee, that it can't come back. And so people understandably live with a lot of vulnerability. And we'll talk here in just a few minutes about some of the triggers of fear of recurrence. A lot of the people that I work with don't have fear of recurrence every day, but they tend to have fear of recurrence when there's some sort of reminder of the cancer. And we'll talk about some of those common triggers here in just a bit. I also wanted to share with you, some of the factors that really make fear of recurrence significant, not only to Andrea and to me, but also, to your healthcare team and, to the National Cancer Institute that funds a lot of research, to work on problems like this. But fear of recurrence is a prevalent problem. Almost anybody who's been diagnosed with cancer is probably going to have a little bit of fear of recurrence at times. However, there's about 40%, up to 70%, depending upon the study that you look at, but 40 to 70% of survivors report what we classify as clinically significant fear of recurrence. And that's just kind of a fancy term for, moderate to severe fear of recurrence that's interfering with their quality of life. And beyond that, fear of recurrence is also highly disruptive. There's extensive evidence that links clinical fear of recurrence to psychological issues like anxiety, depressive symptoms, even post-traumatic stress. Fear of recurrence also can significantly interfere with sleep quality, causing a lot of insomnia for people. It also has been linked with impairments in functioning and reductions in quality of life. And, people work so hard to be successfully treated for their cancer. You work so hard to get through all of those treatments, and you want to have a quality of life that is satisfying to you. And if there's this dark cloud of this fear of recurrence hanging over, it can really interfere with, just peace and ease, in our lives. And so that's what, Andrea and I are trying to work on. Beyond those facts, fear of recurrence can also be very persistent. It tends without any treatment or any intervention from people like me or people like Andrea. Oftentimes, that fear of recurrence just continues to buzz throughout people's lives. It's just kind of a lingering, noise in people's lives, even when the recurrence risk is low. Like one of the most curable cancers out there is testicular cancer, which some of you may have learned more about in the last Simon Says last month with Dr. Carey. But testicular cancer is usually highly treatable, curable. But a lot of times, the young men with testicular cancer do live with a lot of fear of it coming back, interfering with their lives and things like that. So it tends to be a pretty high fear, regardless of the type of cancer or how curable it is. And then also, fear of recurrence has been identified as the most frequently endorsed unmet supportive care need among survivors in several studies. Other studies show that it's one of the top, but the studies that I cite here found that it was kind of the number one for a lot of people. So on the slide here, I've shown for you some of the factors associated with higher levels of fear of recurrence. Younger age tends to be one of those factors. Having children still at home also can ignite fear of recurrence, and it's understandable why. I mean, I've got a high school age child right now, but I'm not ready to die because he still needs me. He still is not set up in his life yet. He's not independent. And so I can tell, I would have a much higher fear of recurrence than perhaps my mom, who's almost 80 years old would have, because, she's pretty, her child, her only child is grown and independent and things like that. So she's still probably going to have some fear if she's diagnosed with cancer, but it's probably not going to be as high as mine is with kids at home. And you can see some of these other factors on the screen for yourself right now. The having a larger number of symptoms or more severe symptoms or kind of delayed effects or side effects from your treatments, that can be a real trigger for fear of recurrence too, because it's that constant, ever-present reminder of cancer and how cancer can sometimes interfere with our lives. So I'll go ahead and move on since you've had a chance to look at some of these other factors. So the news has been kind of bad news so far, but now I also wanted to say that there are some protective factors against fear of recurrence as well. And three of the main ones, survivors who have any of these three things tend to be a little bit more protected. So the survivors who have really strong spiritual beliefs, strong faith, that tends to be a great comfort that can really get people through their fear of recurrence, where they're able to just turn it over, to their higher power. The next little square that you see there is one about optimism. So people who have a more optimistic approach to life tend to be a little less bothered by fear of recurrence. So if you're a glass half full person, kudos. It's hard to change that, at midlife, like if you've always been a pessimist, there's probably been some advantages to you of being a pessimist, but it's going to be hard to kind of flip that around at this point in our lives. But for people who are optimist at baseline, that tends to be really helpful. And then that last slide is just if you have reliable social support, people who are willing to listen to your fears, people who are willing to to stand beside you, people who are willing to give you the kind of support that your heart most needs. Those are the people who tend to get through fear of recurrence with a little more ease as well. So I also wanted to list, I've alluded to this before, but there are lots of triggers of fear of recurrence. So I know I have this one colleague who is a cancer survivor, and, she'll tell me that she will be doing fine, she'll be doing great. She won't even be thinking about cancer. And then all of a sudden, somebody will walk past her office and they'll do this head nod, kind of this, kind of head to the side. I don't know if you can see me on your screen, but it's kind of like, how are you today? When people stop by and say that, that's a trigger for her cancer, because she knows exactly what they're asking, like, how are you doing with your cancer? When is your next, scan and things like that. So just sometimes our social interactions or conversations can be a trigger. But the big triggers are what a lot of people call scanxiety. Whenever you're due for your next scan or your next mammogram or colonoscopy or pap smear, or when you're due for blood work, those are really common triggers for fear of recurrence. And I think we're going to talk more about that later, because I know that we've got a question from someone about that. Also, just medical appointments, whether it's with your oncologist or whether it's, with your dentist, sometimes just going and sitting in a medical chair of any form can really kind of trigger, the fear of recurrence. Also, we'd already talked about people who have more symptoms or side effects, lingering from their treatments. Or if you just feel ill, sometimes that can trigger that sense of vulnerability. Also, cancer is kind of everywhere, on TV and the movies, magazines. There's always something, about cancer, sometimes even on billboards, when we're driving home. And so those can be triggers as well. So that you can see some of the other ones on there, but anytime we go to a funeral to honor somebody that, that we care about, that can be a big trigger for us too. So, and I've even worked with people before who, if they even drive on the same side of town as the place where they were either diagnosed or treated, that can almost, just being on the road that leads to the cancer center can sometimes be a trigger for people as well. So I wanted to shift gears just a little bit and talk about coping. So we all, whether we have cancer or whether we don't, we all have a coping style. And so oftentimes what happens when we are in a vulnerable situation, we are hardwired to cope in one of these two ways that are on the screen. We sometimes cope with hypervigilance, and that's kind of a fancy term for meaning that you're going to be kind of you're going to be, kind of monitoring for problems, so that you can take care of things quickly. And so you're just like really, really aware and just really kind of on edge about potential problems or symptoms or side effects, things like that. So a lot of the people that I work with in clinic are people who, as soon as they have a headache, the first thought that comes into their mind, you guessed it, it's, oh my gosh, do I have brain mets? Or they get, short of breath, on their walk today. They don't usually, but they did today. And then all of a sudden it's, oh my gosh, I have lung mets. Or they have, an ache in their back and it's been there for 2 or 3 days. And oh my gosh, I've got bone mets. And so that happens a lot of times because we're kind of hyper vigilant. People are on edge, about this. And So some of the other things is there's lots of self-examination for some folks as well. And so I've worked with, women with breast cancer history before, where they are doing breast self-exam every day and sometimes multiple times a day, just because they are so afraid of letting something go and they want to catch it super early. And so these are understandable behaviors after somebody has been through the cancer experience. Yet it's one of those things where it just kind of leads to more of a focus on the cancer and less time for for enjoying a nice meal with our partner, or enjoying a ball game with one of our children or something like that. And you can see some of the other things on the slide there. There oftentimes is a greater number of unscheduled outpatient medical visits, calling the office quite a bit with questions. Nothing wrong with that, of course. But if it's one of those things where you're spending a lot of time, like if you have your nurse on speed dial, that might be one of those things where it shows that maybe there's just a lot of discomfort in life. And there might be another way around it, to kind of work with it in a more adaptive way, and we'll talk about that here in just a minute. There's also just the opposite of that, is avoidant coping. And we're also hardwired for this as well, because when we have anxiety, the first thing that we want to do is we want to put our head in the sand. We want to try to avoid it. We want to try to get away from it. We want to try to to not think about it. The problem is, if we're avoidant about things like our mammograms or our colonoscopies, or doctor's appointments that are like our regular follow-up, that could have some pretty negative consequences, in that we might miss something that could have easily been addressed, or more easily been addressed, if we would have caught it quickly. So it could even compromise our health, if we cope with avoidance too much. So, and I just wanted to give just a little bit more information about avoidant coping. And you can see, people here with their head in the sand. And what the reason why I'm really, so why I'm emphasizing coping so much is because we can't necessarily change our optimistic or pessimistic style. We either are an optimist or a pessimist, but we can all work on our coping, to broaden our coping repertoire, to be able to manage and navigate the unwanted sources of suffering in our life. And so that's why I really focus a lot on conversation about coping in our talk today. But anytime we're trying to stop, get rid of, turn away from, avoid, deny our fear of recurrence, there might be some short-term benefits, maybe. So it's kind of like for Andrea and me, when when we've got a paper due for writing up our research results, and we're really kind of overwhelmed, and we feel like we're over our head, we might cope with avoidance. We might plop down in front of the TV, or at least I do sometimes, and that helps for an hour. It really does. But then the longer I sit there trying to avoid my anxiety, what happens is then the anxiety starts to actually build more, because now I've lost an hour or three. So the avoidant coping has okay short-term benefits, but sometimes it can come back to bite us. And so I just wanted to mention that if you are someone where you have a lot of self-awareness, and you realize it's like, oh shoot, I'm trying to cope with avoidance here, and it's just not working very well for me, then that might be a sign to get a little extra support with something like that, from someone like me, a therapist that you really trust, or one of the social workers at the cancer center where you're treated. Because there are lots of opportunities to learn some new coping skills that could be really super helpful in dealing with something like fear of recurrence. And the other thing about avoidant coping is, sometimes it looks like avoidance, but sometimes it doesn't. So I kind of listed for you with that second bullet point how how avoidant coping sometimes functions. So it could look like, completely shutting down, like a survivor just going to bed because he or she is so fearful. They don't want to, take the risk of talking to their family about any of it. So they just literally shut down and go to bed. Or it could be, where there's a lot more blowing up, irritability, about things that aren't even really that important, but it's just, really on edge, because I'm trying to avoid my fear of recurrence. So I'm gonna be angry about everything else or upset about everything else in my life. It can also show up, avoidant coping can show up as, skipping your visits with your oncologist, or, kind of constantly calling the office. Those are both forms of avoidant coping, because calling the office all the time might mean, I'm not really dealing with my fear of recurrence. I just need constant reassurance. And the reassurance works for a minute, might work for a couple of days, but it tends to not have good hang time. So that's why I really like to emphasize, inviting people to really look at their coping style. If you identify some avoidance there, no problem. You're in good company because we all do it. Like I said, we're hardwired, for it, for us, for millennia since the beginning of time. Yet it tends to not be real helpful with something like fear of recurrence. So this is another slide I always like to put up. Do you remember the kids game? It was called whack-a-mole, where you have the little hammer, and then, at different time points in the game, one of these little moles will pop up, and then you take your hammer and you whack it. But then as soon as you whack that one down, then two more show up, and then you're spending a lot of time just like watching for these moles and whacking with the hammer. And that is kind of what avoidant coping does for us when we have, fear of recurrence, or, if you have, like me, if you have, fear of diabetes complications, the more effort and energy we spend trying to whack them all, trying to get rid of our fear, then our life becomes about, whack-a-mole, instead of living our life and, enjoying our life and doing the things that really give our life a sense of meaning, purpose, and pursuing our values in that way. So I always like to throw this up because everybody kind of knows about whack-a-mole, and better than anyone if you've been kind of playing a little whack-a-mole, with your fear of recurrence. If so, like I said, you're in good company. Yet there are other ways that we can talk about here in just a minute. So you might be thinking, she keeps talking about, other ways of coping. Like, what are they? Like, I need information. So here is just in summary. One of the recent, it's called a meta-analysis. And basically what that is like when a research team compiles all of the research that's been done in a certain area. So in this case, it's fear of recurrence. They've looked at all of the other research studies that have been done, and they combine all of those papers and the statistics from each of those papers to get an overall picture of how effective a particular intervention is. And so this particular meta-analysis, that it looks like I did not cite it, but it was published in 2019 by an investigator. Her last name is Tauber, and it was published in the Journal of Clinical Oncology, which is a terrific medical journal. And what this team found is that psychological interventions for fear of recurrence, like the ones we'll talk about here in a minute, had a small but significant beneficial effect on fear of recurrence. And for the people who have some statistical background on the call, I gave the effect sizes down in the little sub points there. So at the end of the intervention, whatever they were testing, whatever the psychological treatment was, what they found was that the effect size was a 0.33. And for a psychological intervention, that's pretty decent. We definitely consider that a worthwhile, intervention. And it was highly statistically significant. So it had some really good power there. At the follow-up, which was on average about 7 months later, it kind of varied, but that was the average. The effect was still pretty darn strong. The effect size was a 0.28. I know that doesn't mean a lot to a lot of people, but there's going to be a couple people on the call who wanted that information, so I wanted to put that on. So what this tells me is that, we're on the right path with some of these psychological interventions that we're delivering in clinic. The only thing is, it stands out to me like I'm not satisfied with small effects. I want home runs, in the interventions that I deliver in my clinic. I want a more powerful intervention. And so that's why I'm doing some of the research that Andrea and I are doing together, is because I'm trying to find a way to hit some home runs where we can have something more powerful for fear of recurrence. But the key interventions or treatments that have been tested so far have been basically cognitive behavioral therapy, which if you go out into the community and get, counseling from anybody, chances are you're going to get, cognitive behavioral therapy from most of the therapists that you would call up on the phone to see. There are different types of cognitive behavioral therapy. There's the more traditional versions that's been around since the 70s. And then there are more contemporary or newer versions. And those are, the ones that I've been, delivering, in my clinic a little bit more often, and have been showing some pretty good effects with the people that I've been working with. So anyway, cognitive behavioral therapy is one way to go. So if you are struggling with fear of recurrence and you're ready to work on it, you could get in touch with your insurance company and ask for the list of approved providers, approved psychologists or social workers on your plan. And then you could just call them and ask, do you have any experience treating people with cancer? And do you deliver cognitive behavioral therapy? So that would be a great way to find, a therapist that way. The other thing is you could get in touch with any social worker at the cancer center where you were treated, whether that was at IU Simon Comprehensive Cancer Center, whether that was at, IU Health West or IU Health North, or wherever you were treated. They all have amazing social workers that you could call, and they can kind of get you set up with some of these things as well. So also the other type of treatment that has been showing some good effects is something that's called mindfulness meditation. So if you're interested in that, you could just kind of Google, mindfulness, meditation classes, and then you could probably find some options that way. If you really, really are interested in mindfulness meditation and you can't find anything, I'll give you my phone number here at the end. And I know a lot of people said, oh my gosh, don't give your personal phone number, but I am, because I care about all of you on here today. But I can definitely refer you. And then the other thing that you can do for free mindfulness training, if you go to Mindful Magazine, if you just Google that, Mindful Magazine, it comes up. There is the first thing that comes up when you Google it. And they have lots of guided meditations that are for free on there, and just lots of good information. So that's kind of a kind of do it yourself way of doing it. Or you can give me a call and I can tell you how you can get signed up for a mindfulness meditation class. Also, there's been, some decent effects of something called supportive expressive therapy, and also some communication skills-based couples therapy. Because as Andrea would tell you in her work, that, the person with cancer, or the cancer history, has fear of recurrence, but sometimes the fear that the partners feel or the family members feel is even more powerful than the fear of the cancer survivor. And there's lots of reasons for that. But we just want to make sure that we don't ignore, the co-survivors, the partners and the family members, because they also struggle, just really painfully with fear of recurrence as well. In case you were wondering if Andrea and I are credible, I wanted to show you just a couple of papers that Andrea and I have published on fear of recurrence. Andrea has actually published more papers on fear of recurrence than I have. But both of these were from a recent pilot study that Andrea and I conducted, at the IU Simon Comprehensive Cancer Center, and also at IU Health North and IU Health Bloomington, where we enrolled breast cancer survivors who were struggling with clinically significant fear of recurrence, and we've got a measure for that. And then we randomly assigned them to 3 different approaches to care. And then what we found is that all the approaches showed some effectiveness, but there was one of the approaches that showed just a little bit more of an advantage, particularly longer term. And so we compared a modern form of cognitive behavioral therapy to just survivorship education, basically a support group. And then also we just compared it to just one session of a little bit of survivorship coaching and giving people some reading materials. And we found that all of those were helpful, but one of them, the one that was the modern form of cognitive behavioral therapy, it was called acceptance and commitment therapy, that tended to show a little bit of an advantage. But again, it was a pilot study, so we need to repeat that. And I'll tell you more about what we're doing in that regard here in just a moment. And I'm going to check in real quick. Andrea, do you know how we're doing on time? Because I am not looking at my clock.
It is 12:35 currently.
Oh,
So would
God.
you like to take just a couple more minutes to talk about your upcoming trial?
Well, actually, why don't we take a few questions right now and then we'll end with some information about the trial. So,
Absolutely. So we received a question beforehand about what are some specific tools and strategies that patients can use when they are feeling that test anxiety or scanxiety that they might have before tests?
absolutely. So some of the things that I have worked on with some of the people that I see in my clinic, the first thing that I always encourage people to do is to just acknowledge and name, their feelings, give voice to those feelings. um, Find somebody that you trust, that you can, who will really listen without trying to fix, the anxiety. And so just acknowledging our thoughts and feelings, describing our thoughts and feelings, that alone can be pretty helpful. From there, what I encourage people to have a great deal of compassion for themselves and acknowledging that, of course, I'm feeling anxious right now because the stakes are high. The information that I'm going to get, the results that I'm going to get are going to be meaningful to me regardless of what they are. I'm hoping for good news, but if it doesn't go that way, it's going to be very meaningful to me because I'm going to have to figure out how I'm going to navigate that. And so I would say just being really compassionate and doing some things for yourself that you would do if your best friend was feeling really vulnerable and scared. What would we do with our friends? We wouldn't judge them, we wouldn't criticize them, we wouldn't tell them to, buck up and get over it. But that's the kind of stuff we do to ourselves a lot of times. And so I would just encourage to think about how would you treat, your best friend, someone that you love deeply. How would you treat them if they were feeling vulnerable and scared? And then finally, I encourage people to come up with their list of what would be a meaningful activity that I could involve myself in right now, not to cope with avoidance. You can just bring the fear with you, on the ride of your life as you're doing and engaging in meaningful activities, and particularly with people who are inspiring to you. So I've got a couple of friends, Andrea is one of them. When I get really, really down, there are certain friends that I want to call because they always make me feel better. I just feel I feel their love, and I know that they are not judging me when I talk about, how upset I am or how scared I am. And so those are the 3 main things: is acknowledge your thoughts and feelings, name your thoughts and feelings, express them, have compassion for yourself, treat yourself like a friend, and then engage in meaningful activities with people who get you and who inspire you.
Yeah, I think an important piece of that is this isn't a one time fix all, that these are ongoing activities that we have to engage in so that, yeah, we can keep that fear in check. Um, and then there was a question about age and if there were age differences in fear of cancer occurrence. And specifically for supporters, should you handle those age differences differently? So, do we need to treat 30-year-olds different than 80-year-olds?
So a couple questions there. So the first one is, although there is some research that shows that sometimes younger survivors have a little bit more fear of recurrence than older survivors, it's kind of wishy-washy. And Andrea, you would probably agree, like it depends on the paper that you read. Sometimes it can go the other way. But I think we have to kind of maybe set aside some of these, like factors, like age and, race and ethnicity and education and all of that, kind of set that aside and just meet people where they are. Because if your best friend is young, or if your best friend is older, but they're struggling with fear of recurrence, we just need to be supportive and kind, and then try to invite them to get the support that they need, to try to start working through it. So I would say it depends. It depends on the person, because there are lots of young people who don't struggle with fear of recurrence, but there are some that do. And there are lots of older people who struggle with fear of recurrence, but some who don't. It just depends on the person. And Andrea, I can't remember now the second part of your question.
Um, I think that hits it.
Okay.
Very, very good. And then we had lots of questions from loved ones of cancer survivors on how to handle their own anxiety and their own fears. One person said that they feel like they missed the initial symptoms of their spouse's cancer and now are constantly looking, and that's making the spouse anxious. And how do you deal with that feeling of anxiety when it's starting to flow over onto other people?
Right. Yeah. Well, and I want to acknowledge that, because that this question comes from a person who obviously cares deeply for their loved one, and they sound like they're really struck by, quote unquote, missing something that they felt like would have been useful for them to notice. And so there's just pain with that, and I think we have to just pause, and we have to just be present for that pain, and like I said, name it, acknowledge it. um, Yet we have to decide now, like, how are we going to relate to that pain and that regret, that we have when we miss something, in a loved one. And I would say that we need to be compassionate with our loved one, and we need to be compassionate with ourselves, and we just have to acknowledge that sometimes, we are going to miss things, and we're going to try not to, but sometimes we are. And we have to try to find a way where, how can I, knowing everything that we've both been through at this point, how can we start fresh right now, where we can be mindful of symptoms so that we don't let anything go, um, but where we can still have a life that's meaningful and that does have some peace and ease to it, where I'm not constantly, looking at you with a microscope. Are there ways that we can support each other through this? Like, when I would just want to say to my partner something like, when you see that I'm looking at you kind of with the worried look, maybe that's a time where you just reach out and you just give me a hug, and maybe that'll kind of break me out of the anxious end that I'm on. And likewise, if I see you, looking really anxious, or really worried, maybe that'll be a time that I reach out and, grab your hand and just tell you that I love you. Because we have to start where we are today, because we can't do anything about the past, right? All we can do is focus on this day, this present moment, and what can I do right here, right now, that would be meaningful, that would add a little peace to this moment.
Yeah, I think that's a really beautiful way to approach a loved one when you're having a hard time or notice that they're having a hard time. So let's take just a couple of minutes so that you can give us an introduction to your study, and then, yeah, we'll close for the day.
Okay. All right. Well, so I have a slide on right now with the title of a new study that we have funded through the National Cancer Institute. And this study is specific to breast cancer survivors. You remember back on slide 2, where I showed you the picture of all of the top male and female cancers. cancer survivors. And because breast cancer is one of there are more breast cancer survivors alive in the US than almost anyone. So that's why this study is specific to breast cancer survivors, but people with all types of cancer have fear of recurrence. I don't want to discount that. But if you are a breast cancer survivor and you are post treatment, you've finished your treatment, but you may still be on hormonal therapy, and you kind of struggle a little bit with some fear of recurrence, I want you to give me a call, because we would love to invite you to join our research team to help us to find answers so that we can improve care for people with fear of recurrence regardless of what kind of cancer they have. So this is the name of the study, and it's a randomized controlled study, which means that everybody who joins the study would have to agree to be randomly assigned, kind of like a flip of a coin, to one of three approaches. So one of the approaches is traditional cognitive behavioral therapy, which has more evidence to support it than anything else, for fear of recurrence. It's been tested more often and it shows, some really nice effects. So traditional cognitive behavioral therapy. And then that one that looks like the word ACT, that is a more modern form of cognitive behavioral therapy that has a lot of mindfulness with it, and some other factors that women in the pilot study really enjoyed and found to be very meaningful. So that's the other arm or the other type of treatment that we're testing. And then we're also doing just one session of survivorship coaching. And actually, Andrea is going to be delivering that. So you'll get, and Andrea's not the only one, but Andrea is delivering that. And it's just a single 90-minute session. All of these approaches, CBT, ACT, and survivorship coaching, will be delivered via video conference, because we wanted to make this as convenient as possible for breast cancer survivors who are busy and that kind of thing. So if you fit the eligibility criteria of being a breast cancer survivor, early stage, if you're out of treatment within the past 5 years and you have some fear of recurrence, I want you to give me a call, and I'll show you my phone number here in just a second. And we're actually going to skip over this for time, but we've got some innovative features, of our study that I can tell you more about if you're truly interested. And so here at the bottom of the slide, you can see that's my direct phone number. So if you are someone who you're interested in the study, or you wanted kind of a referral for some mindfulness training, just feel free to give me a call. If I get 100 calls, it may take me a couple weeks to get everybody called back. But I wanted you to know that I care enough about you, and I wanted you to have this way of reaching me if you need to. So as we get ready to wrap up, I also wanted to show some no cost support. And when I say no cost, I don't mean that it's not high quality. I mean, these are high quality, amazing, and approaches that are delivered at no cost at the IU Simon Comprehensive Cancer Center. My good friends, the social workers, who are Diane Monseski, Janet Hoyer, and Melissa Renbarger, they run the First Mondays program. The phone number on there to get registered is there. The next meeting is next Monday, because it's the first Monday of August, believe it or not. And all the groups are virtual right now, as we kind of get through COVID. The other one that's here in Indianapolis is through the Cancer Support Community, which is up near I-465 and 71st Street on the west side. They offer some amazing programs too, from support groups to educational programs, and their phone number is on there, as well as their web address. And then the other program that I love, it's actually in New York, but it's called Cancer Care. But I go to their website all the time because they have terrific information. Cancer Care offers, individual as well as group support. They do a lot of educational programming. They also offer some financial assistance with copays and things like that. So if you're dealing with some financial toxicity, I always like to give Cancer Care a call, and I've got their phone number on there for you as well. So anyway, I wanted to just thank all of you. I'm going to take my slides down so that we can talk a little more easily. But we probably have time. Andrea, do we have time for like one more question?
We do not, unfortunately. So, thank you all for joining us today. And thank you, Dr. Johns, for talking to us about fear of recurrence and some ways that maybe we can manage or cope with our fears on a daily basis. So, thank you all, and hope you enjoyed the seminar today. And we'll see you again next month.
Thanks again, everyone.